And right here on the executive stage, we have building daily impact. Enjoy. I'll see you all in a little bit.
Okay, so we'll leave Dr. Javier and Dr. Federico Pinto here on the executive stage. Guys, the stage is yours.
Hi, thank you. Well, good to see you. Good to see you, Dr. Javier. It's my honor to be your host tonight. It's almost tonight. Actually, it's tonight in Brazil. So Dr. Javier, it's a renowned cardiologist. He got his PhD from Wayne State University, Michigan, and he's also an adjunct professor there. He has a huge scientific record, more than 50 publications in peer review journals, but he also a great manager and a lean thinker, leading his organizations that he will show us about the Instituto Modelo de Cardiología in Cordoba. Please, Javier, you got the stage.
Thank you, Fred. Thank you very much, Dr. Pinto, for the introduction. It's a pleasure for me to be here, an honor to be here with you. And I hope I'm sharing correctly my presentation. Please let me know if you can see it.
1 minute. Yes, good.
All right. So thank you very much. So good morning, good evening, or good night, depending on which part of the world you are. It's a pleasure to be here. And I just want to tell you a little bit about our institution. It's called Instituto Modelo de Cardiología. It's located in Cordoba, Argentina. It's actually at the center of the country. We are 48 years old and we have 72 beds. It's a boutique type of institution. It's a private institution. We admit around 7.2 thousand patients a year and receive more than 237,000 outpatient visits per year. From those, 62.5 are actually ED visits. Our main specialty is cardiology, but we do have other specialties. So we have actually 53 different departments. And the most important thing is that our patients select us. Okay, so there are a lot of many options here, really near to our hospital as other opportunities. So the patients here are not obliged to come. We don't have our own health insurance, and if they don't come and they don't select us, we actually have no chances to see them. And the other thing is that very interesting is that actually we founded inside our hospital, the Lean Institute Argentina, a couple of years ago, and we have been working towards expanding Lean through the entire country. Our philosophy is actually first comes the patient, second comes the patient, and third comes the patient and the patient's family. The most important for us is actually to improve patient care through personalized healthcare and teamwork. And just to dive into the presentation, talking about the challenges that we have as leaders, let's talk about our board. Our board has macro and, when we talk about macro challenges, we're talking about international and national. Having said this is the economy, the fluctuations in the politics and medical inflation. For example, here in Argentina is very, very high compared to several parts in the world, but it's getting a lot better for the last year and a half. The other challenges that our board has are technical, and tech has been advancing with AI and continuous evolving technologies. Also, the different type of treatments with very high prices that are very a challenge to know exactly, where and to who and at what time to administer. And the other thing is that the micro challenges that we start finding in our region, actually, because we have sometimes lower physicians availability than what we need. Also, some specialties have a lot of burnout, and also there are some difficulties in the near future to meet the patient's needs. So we're very worried about that in the micro scenario. The sector also has challenges for our C-suite, and we are an ambulatory center and also an inpatient institution. We are a referral institution that receives patients from other parts of the state and also the country, because we do high complex treatments, surgeries, procedures, and we have an emergency room 24/7. So it's a very tough situation because it's working during day and night. We also have multiple health insurance programs, and all of them are different, and most of them do pay for fee-for-service, bundle payments, fee-for-performance. So there are all different type of reimbursement for the institution that we have to deal with and take care of. Also, there are multiple specialties, and most of them have always been accustomed to work in silos. So that was one of the biggest challenges to have our institution go through the lean culture. The most important challenge that we have actually is to continue to provide value to our patients and our people so they keep on choosing to work with us and come to see us as patients. So the most important thing for us was to develop the lean culture in order to add value to patients and our own people. So 2012 was when we started, and the board asked, why do we need to adopt lean? So the first thing that was answered was that we need to add value, safety, efficiency, and quality to our patients to obtain a culture of continuous improvement. Also, we were very interested in acquiring international accreditations, and because we needed to work in all our processes, it was very important to adopt lean towards those ends. And in 2017, we were able to acquire the first accreditation in South America for chest pain center from the American College of Cardiology and the American Heart Association. In 2018, we were the first one outside the US in the world to be accredited by the heart failure service lines from the American College of Cardiology. In 2019, we actually received an award, a quality award, actually, for our process improvement in taking care of heart failure patients. And that was in New Orleans in March. And we received the recognition as an International Center of Excellence from the American College of Cardiology. And that was the time when we started the idea of spreading the lean word here and created the Lean Institute inside the hospital. And it was very important for us because we were presenting our results and projects and ideas to the Lean Global Network. And well, we're very happy that it was a great advantage for our institution to be able to develop this institute inside the hospital. And in 2022, we were recognized by a very important organization from Crownsville University at PricewaterhouseCoopers as a hospital. And we obtained the second place in Lean Diamond Awards, where you had some finalists like Rolls-Royce Aerospace, Jaguar Land Rover, Bridgestone. So very important companies were actually selected to go for that award. And it was great that we had the second place. So a little bit about our journey, okay? In 2012, we started this, and it was by doing leaders assessment. So we started with an institution evaluation, but we wanted to evaluate the leaders, because if the leaders were on top of whatever that we needed, to add value to patients, then everything underneath was going to be fine. But if they were not on target, then we had to work with them for them to have their departments aligned too. So the important was to add value to patients' experience and also waste reduction. We started with model cells. Those model cells were in a cardiac rehab program, was the first place where we worked with the physicians, but we started all the supporting areas before working with the rest of the physicians, because there was a lot of resistance, and we will talk about that in a couple minutes from now. So we started working with purchasing, all the secretaries, all the appointment centers, central lab, pharmacy, billing. So everything that goes around the work we do as physicians, for being able to improve that and then capture the attention from all our physicians' departments. The leaders in company education was fundamental to our success. So we started doing leaders workshops, and we did Gemba walks with experts from the US, from Brazil, also from Europe. So we had here actually Dr. Fred Pintos that visited us in 2018. And it was very important for us to be able to exchange opinions and learn from our visitors. So what we were doing fine and what we needed actually to improve. We did a deep dive into leaders physicians education in 2016. We actually took a cohort from here to the US, to Ohio State, to learn from the Academy for Excellence in Healthcare. And then we brought that academy in 2018 to be able to train more leaders here on site. And the most important thing for us is actually to share knowledge and have our in-company trainings. And I'll show you a little bit about it. And we created actually hosted the first Lean Healthcare Summit for Argentina in 2018. But since then, we have been doing a lot of sharing from Lean days, workshops, Gemba walks, and we have our own Gemba for the Lean Institute here in the hospital. So which is very, very good, and we're very excited and very happy for that. So what were the challenges that we had to implement Lean without a leadership? The first one was education and knowledge gap. So we had no Lean thinking training in the universities in all the healthcare environments. So no med school, nursing, tech schools had any type of training in Lean thinking. And there was a lack of access at that time also for training for our leaders from regional experts in operational excellence or Lean. There was a resistance also from our leaders and staff to adopt the culture because there was an ignorance of the benefit that they could have for the patients and for themselves. There was a lack of commitment also because our leaders were in status quo. They usually use the word, we've been doing fine for so many years. Why should we change? There was a lack of employee engagement. And there was also, the reason for that was because there was skepticism and also low interest due to fear to unknown for what's coming. Are there going to be job eliminations? Are we going to optimize processes and then reduce steps and then probably I'll have no job? So we had to deal with that too. There was also a lack of collaboration, problem solving. And the reason is because physicians here and probably all over the world have been always selected because of how much they know about their own specialty. But they're not selected because of their best leader skills, okay, or how good they manage change. So it was a big challenge to have collaborating through all the different silos from each department. And the other thing is that here in healthcare, we have in our institution several nurses, physicians, technicians that work for different hospitals. So there was a difference between our institution's values and other values from other institutions crossing, and it was just a big challenge to go, and have our own organization aligned to the true north that the board has. So what were our countermeasures to all these challenges that I just mentioned? The first thing that came up to our minds, we need to develop our people via continuous improvement in lean education. So a couple of pillars of this lean education, ask good questions, okay? And the first one that we always tell everybody is ask yourself in your head and your heart, what is the best for the patient? And if that is aligned, usually that's something that we will go forward. But if you have any doubt about that, then we'll probably rethink about it. Are we having a good day? Something that we know that we have standards, and when you have a gap, how are things going? And while you do your Gembas, show respect, but be very curious. How can we actually improve continuously? The leaders need to be active listeners, okay? So to be able to improve, you need to have your ideas coming through to you. So you have to have the culture for people to speak up. It's very important to have, very different type of methods to decide what to do, or, ideas that go into a parking lot, or ideas that actually have to be selected to go improve based on a metric, what is called, benefit and effort, and most of the people know that. The other thing is to share results. So very important for us to continuous education is to share results, experience internally and externally. That we do with Lean Days and Summits. But the most important thing, and that's the one I'm going to center the rest of the talk, is about how do we learn? Okay, what courses, workshops, Gangaba walks are we doing for our leaders? We focus on leaders' education because then it's easy for their department to have free time, or it's actually being supported, okay, for their people to be able to devote time to lean work inside the hospital. And the most important thing we tell all our leaders is that, like Karen Ross one told me in one course, we need to lead with kindness. And that's very, very, very important and shows respect. So just to show you a little bit of our activities and trainings that we have done in the past, here is back in 2016, when we have the chief of the cath lab, the chief of heart failure, the chief of vascular surgery, the chief of chest pain, and myself training at the Ohio State University. You have there the matrix of benefit and effort. And we were learning about lean on Columbus, Ohio at the Fisher School of Business. Then we brought the Academy for Excellence in Healthcare for 2018 to Argentina to have more of our physicians and other departments trained. So we had people from human resources, we had the head of finances, we had the head of IT. So all different areas from the hospital needed to speak the same language. Learning from others is very important. So we also are very interested in going and visit different areas. So for example, I had the chance to go in 2018 to learn from Isao Yoshino in a Japan study trip that Ohio State University organized at that time. It was actually led by Katie Anderson, who actually wrote the book Learning to Lead and Leading to Learn, which is about Isao Yoshino's legacy. And the important thing he said a leader needs to have is show direction, provide support, and develop yourself. Also, we had the chance to have Professor Ferro, who was the founder, is the founder actually, for the Lean Institute of Brazil by the end of 2019. And as you can see, he was actually teaching us, how how can we work with LTF? And actually, he was challenging all our metrics and our standards. So it was very, very productive. So it's very important to learn from hospitals. We were able to visit through the world. We went to Japan, the US, Brazil. And as you can see here, the West Coast, we were part of the Gemba Visit for Healthcare Value Network in 2016. We visited also the Wexner Medical Center with the CEO being our guide, which was Susan Moffett Bruce. We were able to visit also in 2018 Japan, the Toyota Memorial Hospital with their process improvement architect, who is there with a couple of other physicians from the US. And my friend, Dr. Fred Pintos, we were able to visit him many times, and we were very amazed of all the great work he was doing and he has been doing with LIB in IOV. We also know that we can learn from other industries. So we were able to visit, many places. And again, all over the world, we were able to visit in the US, Japan, and also in Brazil. You can see here Cardinal Health, Toyota suppliers, and also a TV network in Rio de Janeiro. And what we really are very proud of, is this course that we actually give constantly during the year. So we had, almost for the last 2 months, several cohorts go through our training. This training is, we call it basic, lean basic, but it's more than that. It's more like a practitioner level, where we have a lot of different type of workshop that we do. We do Gemba walks, we go from theory to practice. And you can see here, this is actually last month, a couple of weeks ago, we have the chief of cardiovascular surgery, for example, being part of this cohort, the chief of pulmonology. We have a human resources person. We have people from IT. We have people from our pharmacy, so nurses. So we have a lot of different interaction from different areas to work as a team to be able to learn and then actually be able to develop our people in our own departments. We also know that we need to learn from patient experience. So Gemba walk with them is very important for us. So for example, here we have a patient flow for an ambulatory cath lab procedure, and we were able to identify different waiting moments and which one we needed to target the most to be able to improve and decrease the lead time to be able to treat those patients. We know that doing the Gemba walk, we are also evaluating in a way, actually seeing if we have the true voice, that we actually have the patient's voice, the institution's voice, the processes, and our people. So we're always saying this, actually, we brought it from the Academy for Excellence in Healthcare, that we need to listen to those 4 voices. What does the patient says? What do they think about us? How can we improve? What is the true north the institution needs to have? And the board is actually the one that tells us. What about our processes? So we have to have metrics, standards, and everything. And what about our people? So it's very important for us that our people's voice matters to us. Another thing important to us, and I think Dr. Fred is going to talk about this in less than an hour, it's about cross-pollination, one guiding principle that we actually devote to it a lot inside the hospital. So here we have the huddle in the pharmacy and the huddle in the central lab with people coming and learning what they're doing and how they're doing it and how can they actually adopt things to their own departments. We also have here the Lean Day. This was something that we put into a weekend. It was just free for people to sign in and show. And we had a lot of different activities designed for it. So oral presentations, workshops, poster presentations. And you can see here we had more than 150 participants with actually a lot of different leaders from different areas, teaching and also showing the way they are working with the A3s. And of course, we talked about sharing externally. So our participating in summits, and also we actually did the first summit, Lean Healthcare Summit in Argentina back in 2018. We had the possibility to receive speakers from the US, from Chile, from Brazil. Dr. Fred was actually one of the key speakers for the event. And I want to highlight the picture on the right, on the bottom, because on the front line, those 2 physicians there are part of the board. And they sat down during the entire summit, the entire day. So that actually shows the support we have here in the hospital to be able to adopt the lean culture, as a way of living. So what were our lean transformation results? So did it work? Did it work? All the work that we have been doing since 2012. So if we compare 2 months against 2 months in the same period, but with the 10, about 12 years difference, we can see that we increased ambulatory patient visits by 66%. We also increased hospitalizations by 54% without increasing the number of beds. We also have an increase in ED visits by 92%, and all this was accomplished only by increasing our employee numbers by 5%, which actually we know that we're working better, we're working very efficiently, and actually the patients is selecting us, because if not, we would have not increased. So it's very important that the patient selects us and is not obliged to come to see us. And of course, we have KPI metrics to see that these increases are not going against quality and safety. So what did we see in our leadership transformation? We saw them going after starting this culture of a lean culture in the hospital, going from knowing to learning, going from controlling to coaching, going from imposing rules to co-creating, going from results-driven to process-driven, pushing change to building ownership, and from evaluating performance to reflecting and learning. So a couple of key learnings to share by the end of this talk is that hospitals need to adopt lean culture in order to add value to patients, providers, entire health system, and organizations and payers. And lean is an amazing driver to accomplish safe, better patient care and an efficient use of resources. A call to action to all of you that are listening: design systems that nurture respect and curiosity, build resilient organizations that learn faster than the world changes. And that is not easy. We all know that that is not easy, but it's something that we are actually driven to. And lead by learning, which is very, very, very important. So I want to reflect a couple of seconds now before I finish the presentation and we start the Q&A about a couple of words that, or phrases that resound in my mind constantly. So Abraham Lincoln said once that the best way to predict the future is to create it. And we can't agree more with that. The other thing is that this management professor from Louisiana State University wrote about what Darwin's Origin of Species said. In 1963, this professor wrote about it and said that it's not the most intellectual of the species that survives, and it's not the strongest that survives, but the one that is able best to adapt and adjust to the changing environment. And we can't agree more with that too. But having said this, it's important to remember what also Jim Collins, a former professor from Stanford, who wrote this great book that is called Good to Great, and he actually wrote many other books, Built to Last, Great by Choice. So, but this one is the one that actually where he states that it is important to have principles and values that everyone knows that what they are and what they mean, and that they are incorporated into the organization and also preserved over time. So although we need to adapt and we need to adopt to be able to prevail in the future, we also need to preserve our values and our principles. And you can't forget about that, because it's very, very important for the patient. And in our case is that first comes the patient, second comes the patient, third comes the patient, and the patient family. So thank you very much for your attention. Please stay curious, human, and lean.
Thank you, Dr. Javier. Brilliant presentation. We got really, really touched by the work you've done there and how impressive can be a lean transformation with a great leader. We got 2 questions from Glenn. He asks us, are providers in charge of the lean department?
So I guess that question means that if there are if there is a lean department.
Yeah, I think that's the question.
Okay, so we do have a lean department, but we created the lean department after we trained a lot of leaders. So for example, our lean transformation office probably was created 70 years after we started the lean transformation. And now it's actually led by one of our pharmacists who was working in the pharmacy, doing all the process improvements. She got trained in 2018 with the cohort. And after 3 years in 2021, she joined the Lean Transformation Office. So yes, we do have a Lean Transformation Office inside the hospital, but they are facilitators. The idea for us is that leaders in each department would actually train their own department, okay, personnel.
Great. I got one doubt about cross-pollination. You're training your people, but there are people coming to your hospital to learn and to train. You can train people from other organizations, from other hospitals. You create this opportunity for all of them.
Yes, Fred. That's right. That's right. So we started in 2018, invited our other organizations from the country to come visit us and come learn, the lean culture and what good it does to your organization. So back in 2018, we had people from probably 5 states that came, and we had leaders. Okay, so CEOs, CMOs come visit and learn from us. Since then, once we developed the course, we have invited not only from hospitals, but from other industries. So for example, we had people from schools to come visit us, high schools come visit us. We have people from leaderships. So car dealerships have been BMW, which are really close to us, and they're patients, and they actually saw a transformation in the hospital. So we had the CEO come and visit us and said, we want to learn what you guys are doing because it's very interesting. We had people from a cheese factory. We had people from the countryside. So we had, different industries actually being coming security alarm systems companies. So we had people from all over different industries that came to visit us, to Gemba with us, and actually training with us.
Great, thank you. We are short in time now, so I'll do some. We got a lot of questions. I'll be very fast in the questions here. So, Glenn asked about the census of emergency department, that it increased, but did the cycle time reduce it in the emergency department?
Can you say that again?
The
please?
cycle time reduced it in the emergency department as well?
Well, what we were able to do is in the past, what happened was that we had patients waiting for secretaries and for physicians. All right. So we decided to design a flow that patient will not wait as much, let's put it that way, for secretaries, and we would try to do staff to demand with physicians. So we increased the number of physicians based on the number of patients that are arriving to our ED constantly.
Great. I got another question here. How did you convince from Suresh? How did you convince your board to budget this lean transformation? Because there's a lot of effort and international effort involved and a great training process involved.
Yes, that was tough. That was tough at the beginning, okay, because we had to show some small model cells projects work for them to start buying in. But then the big investments to bring the trainings to Argentina, which was very, very hard. There was this phrase that actually I learned from living in the States, that some people say, why do we train people if they're going to leave? And the worst thing you can do is actually not training and have them stay. So that was something that we actually discussed. We need to train our people, we need to develop them, and we need to enjoy this culture, because it's actually we actually also treat our own patients, families, friends. So we want the best for everybody, and we need to actually do that. So it was based on telling them that we need to invest in this, because we are also patients here.
Great. I got time for a fast question from Oriol. What are your next steps? And
next
I think
steps.
45 seconds.
45 seconds, Oriol, we want to spread the word. Okay, we want to spread the word and have more people come visit us and learn from us, and actually us keep on learning and improving. So those are our next steps.
Great. Well, I don't think we have more time for another question. Maybe we are just here to say thank you, Javier. It's a great experience. We got a lot of people chatting here, saying that it's amazing. It was great. So I think that it's a great experience. Few organizations got the amount of learning environment and work that you've done. Congratulations and thank you. It's an honor to be here. And I think that our friend Christopher is coming back. Oh no, it's not Christopher.
It's Meisha.
Surprise.
Hi.
Thank you, Dr. Javier, Dr. Fred. Thank you for both being on time. It's fantastic. Well done.